Hi folks, Pete Lane. Welcome to another Blind Abilities presentation. Today we present Accessible Pharmacy with co-founder Alex Cohen.
To having difficulties at the pharmacy, whether it's understanding the medication or just not being able to pick it up in time. Well, now imagine having all those problems while being blind.
Well, it's an issue one local man decided to tackle head-on.
My vision continued to deteriorate.
But when Alex Cohen's vision started to go dark,
Well, I have a degenerative retinal disease.
he began to see a new purpose.
Calling pharmacies directly and saying, hey, what do you do for blind people?
Pharmacies that didn't have a plan for helping blind customers.
The blind and low vision community should have a place where they're wanted and expected.
Determination that motivated the Westchester University marketing professor to create Accessible Pharmacy.
I decided to make all of my research targeting how to make a more inclusive marketplace for people with disabilities.
Which started last year in the height of the pandemic, a pharmacy specifically catering to the blind.
Not only do we want to keep people more independent, more active, healthier, we want to give them their time back.
The pharmacy operates virtually and over the phone,
This is Scott. Can I help you?
with packaging that makes medication easy to track even without sight.
Trying to make the existing marketplace more accessible is exhausting. We decided at Accessible Pharmacy, we're going to create our own marketplace just for us, where all of these barriers are alleviated.
All delivered with no extra fees because finances can be a barrier to the visually impaired.
Between 70 to 75% unemployed.
With each pill, independent, as one man's vision loss helped him to see a need that created the largest blind-owned healthcare company in the country.
It's a challenge that we've met head on at Accessible Pharmacy, just trying to show people that there's a better way. You don't have to do this anymore.
They hope to expand their national reach, serving blind and visually impaired people across the country. Channel 6 Action News.
Now, please welcome Blind Abilities correspondent Simon Bonifant with his guest, Alex Cohen.
Hello, everyone on Blind Abilities. This is Simon Bonifant here. And today we have a very, very special guest in the virtual studio. We have Alex Cohen, and he's the founder of Accessible Pharmacy. So how you doing today, Alex?
I am terrific and really happy to be here, Simon. And hello to everybody in the studio audience.
Well, we're very happy to have you. Can you first tell the listeners what Accessible Pharmacy is?
Yeah, of course. Accessible Pharmacy Services has a wide array of services and offerings and different education programs that we offer. But first and foremost, we are a comprehensive medication management healthcare company specializing in the needs of the blind and low vision community. We help all different kinds of patients with different abilities, but our primary focus, what we really do best, is to take care of the blind and low vision community. We understand that the blind and low vision community is not homogenous in any way, shape, or form. Everybody has different abilities, different support systems, maybe different levels of vision, different income, different education. We look at each individual patient as that, a unique individual. So we don't try to go for a one-size-fits-all solution. We try to customize solutions for that individual. When we do that in our intake system, once somebody calls one of our customer care coordinators, we first get their insurance information and we accept all insurances. Once we have their insurance information, we will contact all of their prescribing physicians, whether that's the primary care physician, their endocrinologist, their cardiologist, oncologist, whoever it might be, to see what is being prescribed to that particular patient. And then we present ourselves to them as being part of the team, part of this person's healthcare collaboration, so that we can manage all those medications and make sure that the primary care physician knows what the cardiologist is doing and that the medications prescribed or any supplements or over-the-counter vitamins, anything like that, that those interactions are safe for patients. That's first and foremost. Also, during that intake, we let our patients know about all the different types of packaging options that we offer. I just mentioned some people might be taking a lot of medications and somebody else might just take a blood pressure medication and an aspirin. Obviously, somebody who has diabetes and some other comorbidities is much more complicated than the person just with high blood pressure. We try to find and recommend packaging options that would be best for them to try and help and keep them organized, whether that's daily pill packs or weekly pill organizers that sort pills by AM, lunchtime, dinner time, bedtime, whatever that looks like. We have a package element that will suit most cases. But it's really based on a conversation and a discussion with the patient and what they're comfortable with and looking at their profile. We also offer free home delivery and the continuity of care. We manage all of the refills and reordering so that once a medication needs to be refilled or reordered, we manage all of that for the patient so they don't ever really have to worry about that anymore. And they can just expect to receive their medications in the packaging of their choice, same time each month delivered to their door. We recognize that our patients have different abilities, not just in terms of sight, but also in terms of technology. We offer different labeling solutions. So, of course, we offer braille and large print. We do offer script talk and RFID tags, QR codes, different types of things that people can use to read those labels. We also have a robust reminder system that can alert people when they need to take their medications. We do a lot. I don't want to take up the entire podcast just listing off our benefits, but I think as we might get further in, I can discuss some more things in greater depth.
Oh, yes. One of the things I'd like to stress about the services you provide, and I know you know this as well, sometimes as blind people, we have to find a lot of workarounds, a lot of things that traditionally sighted people don't have to do to access the things that other people would access. And one of the things that really strikes me as a great benefit of your service is that you really try to make it very easy on the user. And especially when you're talking about medications, if a person has a severe illness, their capacity may be limited to have time to spend on doing a lot of workarounds and things like that. So it's really important for them to have an easy 1, 2, 3 experience. So it seems like you really understand that as well and take that into your model.
Part of that is I myself am blind. We hire blind and low vision individuals from the community to work as our sales representatives and as customer care representatives. So we get it. The person that you're speaking to on the other end of the phone or corresponding with via email or through our social media channels gets it. We understand the challenges. That being said, we don't understand all the challenges, but we will find a solution. For example, right now, we are doing a lot of work with the Helen Keller Foundation, working with people with dual sensory loss, the deaf-blind community. So with those patients, finding out really what works best for them, what's the best way to communicate with them. We really enjoy having a discussion because we get more information that way. We find that people are more comfortable talking to us and we can get more accurate information and also really get to know our patients.
Yes, definitely. I know that you mentioned you are blind yourself, and that's one of the great things about you being a founder of this company. Can you talk about what's been your experience as a blind person through your life?
Well, sure. I wasn't born blind. I do a lot of public speaking at schools and talking to kids with a variety of different disabilities. And I always have to preface anything by saying, my story is my own. What I've been through, the experiences that I've had, I would consider being unique to myself. I myself was not born blind. I always had trouble seeing. I was always extremely nearsighted and had trouble seeing, particularly at night or at dusk. When other kids were able to play baseball or football, as the sun was going down, I found that I was no longer able to see the ball. As I got a little older as a teenager, things like going into a dimly lit restaurant or movie theater or a house party or driving at night was very, very difficult. In my late teens, I got LASIK surgery, which really did wonders to correct my nearsightedness, but it didn't alleviate any of the problems that I was having with seeing at night. So I went to Wills Eye Hospital here in Philadelphia and was diagnosed with retinitis pigmentosa, which is a degenerative retinal disease. I said, okay, great. Well, what do we do about that? The doctors at Wills said, well, there's not really much going on for that. And this was over 25 years ago. But, there's a guy in Boston doing work to try and through different nutrition supplements to halt the progression of the disease. And so I went up and became a patient of the late, great Dr. Elliot Burson up in Boston. Over the course of time, my vision continued to deteriorate more rapidly. At that time, I had gone to school in Las Vegas at UNLV because I had always wanted to be a hotel general manager. It was like my lifelong dream to do that. I started working in the hospitality business in hotels from the time I was 15 years old, and I ended up reaching that goal. I became a general manager of a hotel here in Philadelphia. And as my vision continued to deteriorate, the hotel was being sold and I was looking for other opportunities. I found it was very difficult to find work. or to get hired as a hotel general manager. You would, go in and have your cane and people, Anyway, I don't want to dwell on that. But I made a decision, okay, maybe I can't work in hospitality. I'm going to go back to school and become a professor. I'm going to become a hospitality professor, right? Teach hotel administration. And there are lots of wonderful universities around the Philadelphia area that have those programs. So I'm going to do that. And so I went to the Philadelphia branch of the Occupational Vocational Rehabilitation and Blindness and Visual Services. And they told me to apply for Social Security Disability, which I was granted. Through their support, I built a collaboration between OVR, BVS, and the Office of Disability Resources at Drexel University, got funding for my master's degree and all the technology that I would need to go back to school. Screen readers, Zoom Twix cameras, all the different technologies that were available then that I hadn't previously been exposed to, especially when I did my undergraduate. My eyesight was not good, but I was not in the same situation that I was later pursuing the master's degree. And so after I completed my master's degree at Drexel, I was accepted into a PhD program in marketing at the LeBeau College of Business. It's a 5-year program. I graduated, became a marketing professor at Westchester University, about 30 miles outside of Philadelphia. I love the job. I love my colleagues and my students, and I couldn't be happier in that position. But you might ask, what's the connection between hospitality and marketing and accessible pharmacy? Well, I guess I didn't really understand this when I was an undergraduate, but I thought my professors were just there to teach me. And that's all they did, was teach classes. It's a little fancier than being a high school teacher, but that's all you guys do is teach classes. That's not true at all. There's a good deal of scholarship and research and community outreach that's involved with being a professor. I had decided to make all of my research targeting how to make a more inclusive marketplace for people with disabilities. And so it was out of this research that I did that found the opportunity for accessible pharmacy.
What kind of research did you conduct and how did that work?
It started through a personal experience. I don't know about you and the rest of your audience, but I find almost nothing more frustrating than an inaccessible website. It drives me bananas and is a continual source of frustration. I started looking at the online retail environment, measuring the accessibility of the top 100 retailers in accordance with the National Retail Federation. Saw that the vast majority of these, from the home pages, the career landing pages, the transaction landing pages, were hopelessly inaccessible. They had so many errors and problems on them that, realizing that this was a good source of research, and then started to look at the human side of this. Not only how did this make people feel, but also how did they react from a consumer standpoint. For example, let's take you, for example, Simon. If you ran into an inaccessible website and you were very frustrated about it, would you tell other people about that? Would you post about that experience on social media or in some kind of group to let people know?
Yes, I probably would. Yeah.
Now, if they were blind or low vision, they would probably react the same way you would. They would avoid that retailer. Now, what would happen if you told a sighted person, a friend or a family member, about that frustrating experience? Would they have the same reaction?
Probably not. They would probably see how we get frustrated, but it wouldn't affect them in the same way.
So what I found is it actually does.
Oh, okay.
What I was looking at was something called substitutional empathy. What happens is that based on the relationship that that person has with you, with the person, they will also have negative reactions, negative behaviors towards that retailer. And it doesn't have to come from somebody they know. What we found in the research was, for example, if my wife were to read about an inaccessible experience that somebody else would have, another blind person would have, she would substitute me into that scenario, into that situation for that blind person, and then react to that frustration as if it had happened to me.
Wow, that's very interesting.
And make her reaction even stronger. As a warning to retailers, an inaccessible website doesn't just affect the blind and low vision community, it also affects those sighted individuals that will empathetically change their behaviors based on the relationships they have with people in the blind and low vision community. But I got a little bit ahead of myself. Where the pharmacy thing comes in is when we were looking at what types of businesses were really inaccessible. And we looked at specific categories, clothing retailers and home improvement, hardware, grocery stores. And of course, we looked at pharmacies, both standalone pharmacies and pharmacies that were inside big box retailers and grocery stores, and specifically tested how inaccessible the pharmacy websites were and found that they too were incredibly inaccessible. My partner and co-founder of Accessible Pharmacy, Andy Burstein, at the time I was doing consulting work with him, and he was working in the accessibility technology space. And I told him about this research, and together we started developing this idea of like, there's got to be a solution for this. And so we started doing, more market research. You're never done. You never really hit the bottom.
Yes.
And so we started doing field research, calling the 1-800 numbers and calling pharmacies directly and saying, hey, what do you do for blind people? Recording those conversations, doing content analysis and trying to find out, what are the common reactions when we ask people this? Or when we go to the pharmacy and we go to the pharmacist and say, so what do you do for blind people? And they would typically give you one of three different answers. One would be, we don't do anything. We don't have anything. Okay, that's a lousy answer, but that's an answer. The second would be, I think that we can print out the labels larger. Would that help you? And maybe in some cases with low vision, that might help as a solution. And the best possible scenario that we ever received is I think that we have something somewhere that can read labels to people. I can't remember the name of it. I'd have to really look around to find that information. And of course, they're talking about Script Talk, which is a wonderful company that's been in business for years. And we support Script Talk and work very, very, very closely with them. They're a wonderful partner of ours. We just found that people's needs were not being met. We launched our company, I think, in May of 2020, right in the middle of COVID.
Man, that's a very opportune time to release something like this. Yeah.
Except it was hard to go, from a sales perspective and going out to meet people. I think people were just still trying to get comfortable with the Zoom meetings.
Oh, yes.
So it was actually a little bit more challenging to try and reach people. But offering the free home delivery that we do for our suburban, urban, and rural patients, this really is a much added wonderful convenience for them. Not only do they not have to take public transportation or try to somehow get to their pharmacy to pick up their prescriptions. As a blind person, I can wear a mask, but it's hard to social distance.
Yes, and also for a lot of blind people, transportation can be a barrier.
Yeah, absolutely. Also, it's not fun. Trying to get around is a challenge. Now, I don't let it stop me, and I've never let it stop me. It takes a lot of work, a lot of energy, and frankly, a lot of anxiety to get around. So taking the bus or walking someplace, I don't want to go to a pharmacy. I want to go someplace fun. I would rather go and do something that brings me joy. It's nothing against the local pharmacy, the Walgreens and CVS's and the Rite Aids of the world, but it's no fun to be in there. This is not where I want to be. I don't think anybody ever walked into one of those places like, this is great. That's why we offer some of the services we do specifically to alleviate those barriers and challenges. When I had mentioned before, right, doing the sorting of the pills and the daily pill packs and the organizers and everything like that. I don't know how long people spend sorting their pills, but I know from my grandparents, it seemed to be an hours-long production. What if you had somebody do that for you? Right? And it was delivered right to your door. You didn't have to worry about it. Everything was pre-sorted from your prescriptions, your vitamins, your over-the-counter supplements, whatever you're taking. And it's all there laid out for you, safe, effective, organized. Wouldn't you like to have that time back to do something that brings you joy? Not only do we want to keep people more independent, more active, healthier, we want to give them their time back.
Yes, absolutely. Time is valuable. So I'd imagine you do a lot of outreach for Accessible Pharmacy. Do you go out to pharmacies and promote your company to them, and you have to give them training how to work with the blind or how your service works?
That actually isn't how we work. We're a standalone pharmacy. Our physical pharmacy is located in Fairless Hills, Pennsylvania, but we're licensed in currently 31 states. So we don't work with other pharmacies. What we want people to do is become patients of ours. To call Accessible Pharmacy, come to our website at accessiblepharmacy.com.
Oh, I see. Yes, I understand.
Because one of the things that people who work in blindness and disability advocacy can tell you that trying to make the existing marketplace more accessible, more understanding is exhausting. It's necessary,
Yes.
but it's exhausting. It's exhausting to the point where we decided at Accessible Pharmacy, heck with this, we're going to create our own marketplace just for us, where all of these barriers and challenges are alleviated. Everything is accessible from the website and our app. Everything we do has accessibility in mind to alleviate those barriers and challenges and make people's life easier, where this is one thing where we can say to the blind community, we've got this. You don't need to worry about this. You don't need to worry about accessibility here. We got your back. We understand, we're part of the community, and that's what we're all about.
Yeah, and I'm sure that it makes a very streamlined experience that way on your part and also on the part of the customers.
Yeah, absolutely. And so our customers have been delighted and really happy. We continually do outreach to people all over the country, really, to try and educate them about the services we provide and that there is a better solution out there. But as you know, Simon, I'm sure blind people tend to stay with what they know and what they're comfortable with. You walk the same route to a place because you know the bumps in the sidewalk, where the low-hanging tree branches are. You stick with what's comfortable because it produces less anxiety. People's healthcare is really important to them. So what we're trying to do at Accessible Pharmacy is to let this community know that, hey, there's a better solution. And sometimes it's hard to break people away from that inertia of going to that local pharmacy, even if they don't have the same accessibility solutions or they charge more or don't offer free delivery or aren't understanding. That's been a bit of a challenge, but it's a challenge that we've met head on at Accessible Pharmacy, just trying to show people that there's a better way. You don't have to do this anymore.
Yeah. And I noticed that you mentioned that all different people that use different technologies, different skill sets of technology can access your services. Can you touch on that a little bit?
So we've developed an app that has a OCR camera and a QR code reader. It's all voice activated, so it can read any labels we have. Of course, people can interact with us through our website and through social media. We are a pharmacy partner of Be My Eyes. I'd imagine that your subscribers at this point are familiar with Be My Eyes.
Yes. Yeah, we've talked about them and had them on.
We're part of their specialized help. So if a person on Be My Eyes ever had difficulty with something pharmacy related, needed to identify a pill, read a label, see how many puffs they had left on an inhaler, or help with measurements or anything like that, they could communicate with Accessible Pharmacy through Be My Eyes. This is assuming that your patient group is good with a smartphone or good with a computer. We deal with quite a large senior population. Sometimes technology presents its own challenges, and those individuals would rather speak to us on the phone anyway. But they would also like to speak to us on the phone and not get stuck in some kind of voicemail hell where they have to listen to all the prompts and be on the phone for 20 minutes, half an hour before you can actually speak to a live person. That doesn't happen at Accessible Pharmacy. You call and talk to somebody right away. So that's what I mean between the high tech and no tech kind of solution. So we can meet our patient group where they are. If people are happy communicating with the app and through the website or what have you, that's wonderful. And we're happy to accommodate that. But if somebody wants to have a phone conversation with us too, a landline, you hear about other pharmacies being so proud about developing some kind of app that helps blind people read labels. Well, this technology has been around for a long time. OCR, QR codes, RFID tag readers. This isn't new technology. Congratulations for being, 15 years late to the show. You could say better late than never. What do you do for the blind individual that doesn't have a smartphone? They're just as stuck as they ever were. You're leaning too heavily on innovation and technology, and this patient group, this block, is not following you at the same speed.
Yeah, well, that's great. I think it's great that you have options for all different levels of technology, so it should not be a hindrance to anyone. That's great. Now, I noticed that you mentioned that you connect with the customer's insurance. Does that mean that they don't have to pay any extra for the services that you provide?
This is how this works. The insurance company makes those decisions. So people's costs, their copays, should not go up as a function of joining Accessible Pharmacy. So if somebody's on Medicare or Medicaid, anything that they get from us should not go up. But there are lots of different types of insurances. And so sometimes there are plans where that insurance provider has made a specific contract with one provider, and for somebody to try and get out of that costs them more. Now, what we will try to do with Accessible Pharmacy is advocate for that patient at their insurance company. Like, hey, you're making them go through this other provider, but this other provider doesn't offer these accessibility features and accommodations which this patient really needs. And so you're not treating them fairly. And sometimes we can sway the insurance provider and sometimes you can't, but at least we try. I can't say that 100% of the time, but most of the time people's costs don't go up. And the only way to really find out is to give us a call, and then we can check into the insurance and make that happen. Now, we've also worked with insurance companies to provide different types of accessible medical devices, blood pressure machines or different glucometers or what have you, that sometimes won't get covered by insurance. We advocate on behalf of our community, of our patient group, to try and get things taken care of for them.
That's great. So I know that you really want to help the community, and you demonstrated that throughout all the things you talked about today. Where do you see Accessible Pharmacy expanding, or what type of things can users expect to be upcoming? Do you have any things in the works? What would you like to expand on?
So there's a few different ways to answer this. First is we are trying to get licensed in the rest of the country. Sometimes that's difficult because sometimes some of these states demand that you have a pharmacist licensed in their state, which can be difficult, meaning somebody has to fly down to Texas and take a test. It's not as easy to expand across the country, but we are taking efforts to do that and to make that happen. Other services that we're looking at offering, we are about to launch a whole program of unit dose, pre-measured prescription and over-the-counter children's medication to help blind parents more independently care for their sick children. We're also going to be pushing our pet medication program as well, so that we offer the same services, packaging and labeling for pet medications as we do for our human patients. People who have guide dogs or other animals who need medications, they can get that through us as well. And we're very, very proud about our educational seminars. December, we're having a very exciting program, a conference actually, all about diabetes education and awareness. Later in the spring, we'll be hosting another large event promoting breast cancer health and awareness. One of the challenges we've noticed is that a lot of the information that comes to women regarding breast cancer and checks and what have you are all illustrations.
Yeah.
So we're looking at ways to make that type of information more accessible. And we're looking at having different educational seminars and webinars actually just about every month starting in 2022. So that information can be found on our website, Facebook and Instagram pages, and people can sign up and register for these things. We're here to stay. You know, healthcare is a moving target. A year ago, we were really excited about our COVID testing program.
Oh, yes, I heard about that.
And we had many people take advantage of that, but that was a bit short-lived because starting in February, March, everybody was more interested in the vaccines, as they should be. We definitely promote everybody out there to get vaccinated. It's the best way to stay safe and keep your family and friends safe as well.
Oh, yes, I agree.
So those are things that, like, you work really hard on that, and now that's not so much of a thing anymore. You're just always moving on to the next thing and next way to try and help patients.
Yeah. Well, can you give the contact information for how potential customers can contact you and get connected as a customer? I think a lot of our listeners will be very interested. So give us your website and the way that people can get a hold of your social media, things like that.
Absolutely. The website is accessiblepharmacy.com. Again, it's accessiblepharmacy.com. You can always call us at 215-799-9900. Once again, that number is 215-799-9900. or you can look us up at Accessible Pharmacy on Facebook and Instagram and contact us through that as well. Also, you can contact us through the specialized help section on Be My Eyes. There's lots of ways to get in contact with us, and we encourage you to make the call because there is a better way. We really want to promote accessibility, accommodation, and community. We're here to serve this community. We hire people from this community. We care deeply about our patients and our employees and just want to promote accessibility and encourage people to take better care of themselves.
Oh, very nice. As we close tonight, I always ask this question to our guests. What advice would you give as a blind person? What general piece or a few pieces of advice would you like to give to the blindness community that have helped you along the way?
Don't deny yourself anything. If you want to try something, don't be afraid. Don't let things hold you back. That's something that I've found to be very useful. I don't want an opportunity to pass me by, an opportunity for anything, an opportunity to learn something new, to experience joy, to do something with my children, whatever that looks like. Don't let blindness hold you back. The other thing, this might go against the grain of the independence, but what I found is most people want to help. Most people are kind. I've experienced that a lot living in Philadelphia. I think it's nice to practice what I call selective dependence, which is asking for help from time to time to make something easier. I'll give you an example, Simon. I can find my way out of 30th Street train station, but the place is huge and it's bananas, and it's going to take me a long time.
Yeah.
If I can save 15 minutes of my life by maybe asking for help to reach a certain exit, I'd rather have that time.
Yes. I agree. Yeah. Like you said, I think it's about choosing when you want to use different tools to get assistance or do it yourself.
Yeah, it's selective dependence. I never want somebody to grab me by the back of the shoulders and try and steer me around like, no.
Yes.
That's not okay.
It's not good.
People are genuinely kind and want to help. I don't know. In a way, it makes me feel even more a part of the community.
Yeah, I would agree. I definitely agree. Well, thank you, Alex, very much for talking to us on blind abilities today. I really appreciate it. And to the listeners, be sure to head over to accessiblepharmacy.com, call them on their number and get information. We'd really like you to get connected with them. You really do a great job, Alex, in your work. We thank you for all the contributions you have made to the blindness community.
Thank you so much, Simon. It was an absolute pleasure to be with you.
We'd like to thank Simon Bonifant and his guest, Alex Cohen of Accessible Pharmacy, for joining us today in the Blind Abilities Studio. And for more podcasts with a blindness perspective, check us out on the web at www.blindabilities.com. We're on Facebook and we're on Twitter. In the meantime, thanks so much for listening and have a great day.
When we share
what we see
through each other's eyes, we can then begin to bridge the gap between
the limited expectations and the realities of blind abilities.
The realities of blind abilities.
For more podcasts with a blindness perspective, check us out on the web at www.blindabilities.com, on Twitter at blindabilities. Download our app from the App Store, blindabilities, that's 2 words, or send us an email at info@blindabilities.com. Thanks for listening.